Welcome to Minnesota Nurses Association. My name is Mary C. Turner. I'm president of Minnesota Nurses Association. More importantly, I am a ICU nurse at North Memorial in Robbinsdale. And today, this is the day of our strike vote that started at 6 a.m. and will run till 2200 tonight. I just came from our voting site at North Memorial, and the numbers are already, nurses are streaming in like they're streaming in like their lives depend on it, and it does. We never wanted to get to this point. When we came back from our last strike in September, we hoped our hospital executives would hear us about the urgency of the crisis in our hospitals. But since then, things have gotten worse and not better. I know at our bargaining table, the last 4 times, we have brought a litany list of nurses that were hurt over the weekend. One call that I got from a nurse just recently said, "Mary, I almost died today at work." I mentioned that before at the rally. Workplace violence is unacceptable. And a lot of that can be cured if we had proper staffing. Our hospitals are full. These nurses behind me will speak to that. They are full. And I've already got nurses that are signing up for 16-hour shifts this coming weekend. That's just becoming a way of life, is for our nurses to all work double shifts so that their floors can be covered. Because like I've said before, 51% of us could be gone from the bedside, and we are seeing that in action right now. We are seeing floors that have no scheduled nurses. And so our nurses are filling in. Nurses have tried to make movement at the table to settle fair contracts for the nurses. We've lowered our wage asks. We're down to 20%. We have offered a new staffing proposal, which would use key indicators for nurse and patient well-being to determine when our staffing levels need to be reviewed. So basically, when the falls increase and the bed sores increase and things like that, and the nurse injuries increase, that's when we would review our staffing, because those are all indicators that the staffing is not sufficient. And our executives, though, continue to say no on staffing. They continue to say no to the biggest issue to improve care for patients and keep nurses at the bedside. Nurses can't go on like this. Our hospitals can't go on like this. That's why we're here today taking this vote, because this is our power to win the contracts we need to put patients before profits. Thank you. And I now call on Kelly Annis from Abbott Northwestern.
Hi, my name is Kelly Annis. I'm a registered nurse in the medical surgical ICU at Abbott Northwestern Hospital. I want to take a moment to address the response that we got from our employer when we were here just a couple weeks ago announcing another strike vote that's being held today. They called it public theater. They called it opportunistic. And the word opportunistic really struck me, because opportunistic is how these healthcare systems run their businesses. Opportunistic was them implementing crisis staffing during the peaks of the COVID pandemic and then never letting up when we weren't in those peaks and surges. And it just, like, public theater, I struggle with that as well, because truly, if a moral argument, if conversation with these employers was going to work, the ink would have been dried on our contracts 6 months ago. We wouldn't still be doing this out in the middle of the snow. We'd all be at home or at our jobs instead of having to organize another strike vote of 15,000 nurses. I also want to talk, as Mary mentioned, that we have come down significantly on our raises, and with every offer of a raise that our employers have given us, they haven't been retroactive. Well, for anyone keeping track, we are now almost 6 months past when our contracts expired, meaning that the past 6 months that nurses have been working, the wage offers that the employers are offering, we wouldn't get. We'd only get them for the next 6 months of our contract for this year. So really what we're getting is half of what the employers are offering us. So they can tout significant wage offers, but they're not really offering that full percentage. I want to let the public know, because as Mary mentioned, the hospitals are full, that this fight is as much for you and your loved ones and your livelihoods as it is for us and our families and our loved ones and livelihoods. That we are doing this so that when you come to a Minnesota hospital, you can expect the quality care that used to exist. You could expect prompt attention from the nursing staff and a nurse that isn't overworked and has had a break and all of those things. And that's really what this campaign continues to be about. It blows my mind that there are companies, these healthcare systems out there wanting to fight those basic ideas, but here we are. With that, I'd like to introduce Amy McGlone from St. Paul Children's Hospital.
Good morning. My name's Amy McGlone. I'm an RN at Children's in St. Paul. I've worked there for 24 years. I work in the NICU, caring for the smallest of patients. And we're here again fighting for our profession and for our patients. What we are asking for and pushing leadership for is improved staffing numbers. We have been and continue to be in a major staffing crisis. To put it in perspective, I worked this last weekend and most shifts in our unit were 9 to 10 nurses short. That puts more work on the nurses that are working, less visibility to parents and patients, and it's just not safe. Most recently, we have exploded with respiratory patients, children who are sick, really, really sick. Most belong in the ICU. We don't have enough ICU beds, so they're on the med-surg floors. You could have a sick patient who's part of a 4 or 5 patient assignment because the unit is so short-staffed. 6 to 8 hour waits in our emergency department. Kids scattered around the waiting room, the cafeteria, conference rooms, far away from the emergency room. Besides the ED waiting hours, the ED is full of inpatients who have nowhere to go, sometimes because we have no staff to staff the bed that they could possibly go to. The ED is a disaster zone. They are working sometimes with only 4 to 5 nurses, and they have a waiting room of 75 kids and a unit of 32 rooms that have 2 weeks ago, 27 inpatients, leaving just a few rooms for them to shuffle the dozens and dozens of patients that are sitting in the waiting room. Our hospital has lots of buzzwords, all hands on deck. That was their famous buzzword in the past. They did a newscast where the upper leadership was shown in the ED doing tasks in front of a camera. Well, the cameras are gone, and so is leadership. We've been begging for help for 2 years. It's fallen on deaf ears. Our leadership tells us daily, we hear you, we value you. They have a funny way of showing it. They spew empty promises and say they value us, yet when asking for help with staffing, they do very little or nothing. On September 23rd, I emailed my nurse leader, our chief nursing officer, asking her to join with her nurses to help work on these issues. Today is November 30th, and I have yet to get a response. Our hospital is on life support. We need change. We need improved staffing. We need our leaders who claim to value us to prove it. Our patients and families deserve it, and we, the nurses, deserve it. Thank you. Next is Ali Marcanti from United.
Thank you. This is honestly so frustrating. We know full well how disruptive a strike is to hospitals and patients. We have authorized another strike we're voting to authorize another strike because the conditions in the hospitals are untenable and we're fed up with sacrificing care. Nurses deserve a say in staffing, period. We are the only ones capable of determining what is and what is not safe. The hospitals have said we are asking for operational control. The reality is we are asking for control over our own practice. Let's say a nurse is taking care of your family member and then expresses concerns that they will be unable to adequately care for them with their current or suggested assignment. A supervisor that hasn't provided bedside care in decades can say, nope, the assignment's safe, make it work. This is happening every day. Nurses that have expressed concerns over their assignments have been disciplined and sent home instead of being provided with a proper assignment. We want that to end. A nurse concerned about your loved one's safety deserves a megaphone, not a gag order. Our negotiating teams have put in so many hours crafting modifications to our staffing proposal in an attempt to reach a compromise. We're just not seeing that same effort from the hospital side of the bargaining table. Employers have only recently begun even asking questions about our staffing proposal as of bargaining date number 18 of 21 for Allina. 18 rounds of bargaining before they even entertain our most important proposal. Prior to that, not interested was their perpetual mantra. Let's be clear, we are not the ones dragging this out. Hospitals can end negotiations and stop the strike at any time. Hospitals need to get serious and address nurses' concerns in order to avoid a disruptive strike. Thank you. I'll turn it back to Mary Turner.
Any questions?
Mary, can you be more specific on your new staffing proposals? You don't seem to be pushing the thing where you have control over the committee anymore. What do you want, and what would turn this into?
Right. So you're referring to the 51% that we had wanted, that if you're going to make a change to a floor, that 51% or half your nurses would have to agree to it. And I've always pushed that if you can't convince 51% of a change is a good thing, then it's not a good thing to do. That would have been a very simple thing to do, but they said no, that gives us the control. I suppose it's the 51% that freaks them out. So what we have replaced it with is something that they keep track of anyway. Taking our quality measures, like falls, injuries, decubiti ulcers, all the things that they have to keep track of for Medicare and Medicaid anyway, and is on all of our units, I'm sure. We all have quality boards, and they keep track of this on a monthly basis, so the information is there. What we would do is that if those numbers start to go up, and collectively they reach 50%, you know, if you're getting increased falls, increased injuries, increased ulcers because the people aren't being turned, that tells us that the staffing is not adequate. And so they were referring it to as, oh, well, you took that out, the vote out of there, but now you put triggers. Yes, but they're triggers that make sense. And, you know, I've ran this by nurse educators at the U of M who thought this was a brilliant idea to tie it to these indicators. And you would think that the hospitals would think this is a brilliant idea.
If you hit those triggers, though, what has to happen
Then you get an assessment goes on, and we are actually calling that we get increase on our grids. Remember, we work off a grid, that those numbers be increase by a certain amount of nurses. Okay. I think I explained that right, guys. Basically.
No discipline.
Oh, also, right. Also, no what Allie talked about, or was it? Yeah, about if a nurse assesses an assignment and says that is unsafe, that they will not be disciplined and sent home. How non-productive is that, to send your people when you don't have enough anyway? So we want it in there that we will not be disciplined for refusing an unsafe assignment, as is our right under the Nurse Practice Act. What else?
ED triggers.
Oh, ED triggers. That's the other thing. I don't care which hospital you go to, you are going to hear that the EDs are a disaster area. I have personally visited some of them. I was at Fairview Riverside not too long ago. It looked like a war zone. And we want triggers that if it gets to a certain crisis level in the ED, that staffing will automatically be increased on the floors so that we can take the patients into the beds that are not staffed and get them staffed. Okay, so those are the kind of changes that we want to make. All of them, once again, common sense. Might I say good business? Because people just hanging out and leaving without being seen. I'm not a business person, but that doesn't sound like good business.
Other questions? Hiring with a 6% or so gap in wages, you've come a lot closer than you were before.
Mm-hmm.
Does that make this the right timing for this kind of action, or does it say you stay at the table and kind of close that gap? Because it seems like you're a lot closer than you were when you went on strike.
We are. They're at 14 and a half. Not every table, but and then we're at the 20. And so we are in the range. They had said a few weeks ago at my table, the lawyer had said, well, we need to be in between 13 and 20%. So we're there, you know. And so now I expect that, you know, stuff should start taking off. We should start being able to settle stuff. Well, I was just at the table yesterday. We had all high hopes that they were going to start looking at our, you know, come back with a counter. Because we left the table at North last week, laying it on the table 20%. So it was their turn to come back. We didn't get anything. Crickets. They did the old looking at our staffing now for the first time. They just wasted the day and had no intention of coming back with any numbers.
Should M&A nurses vote to approve this strike and then kind of that 10-day notice period, that puts us closer and closer to the holidays.
Mm-hmm.
If this strike does happen, what does this mean for Minnesota hospitals and care in Minnesota hospitals as we get into that holiday season?
Yeah, well, the first thing is we need to get the vote. And we will know that shortly after 2200 because now we do the vote electronically. So not wanting to get the cart before the horse or the horse before the cart, whatever. I don't know why I try doing that kind of thing. But anyway, after that, then the negotiating team decides off of the assessments, you know, and we have a decision and we know what we're going to do, and that will be announced tomorrow. So, going into the vote, our ballot says you authorize a strike, yes, or you don't authorize a strike, no. That is what our ballot says. That is what it always says per our policies, actually. So, I know you want more information, but that's the best I can do right now. Yeah.
How many nurses are voting today, and where do they vote at?
We have potentially 15,000, and we are able to keep track of that too. My OR nurse at North Memorial was the very first nurse to vote in the state at 6 o'clock sharp. Some of us have at the hospital. North is voting at the hospital. Is Children's voting?
Yes. Mm-hmm.
Children's is voting at the hospital. I believe Alina is off-site, right? Or
It depends on the hospital. United is at the Labor Federation.
oh, right. United down the street is at the Labor Fed. I believe Mercy and Unity are at either a hotel or something back in their area. So it all depends. Here is also a site. As you guys came in, you might have seen. And we've encouraged any nurse, like if I have North nurses that live in St. Paul and are close to here, I'm saying you can by all means come here. So.
And you should know results, I thought I heard.
Well, the polls close at 2200 and it's done electronically. How long do electronic things
within the
take?
hour.
Within the hour. So stay tuned tonight.
At 10 o'clock, right?
Yeah.
Okay.
Oh, sorry, I talked military time. I'm so sorry.
Check myself.
I don't know any other ways. I'm sorry.
Can I say something?
Yes. Yeah.
Yeah. I just want to be clear. It's not about the money. There's a lot of people out in the public that say, oh, those nurses, they're greedy, they want more money. I don't care really about the money. It's about the patients, patient safety, the quality of the care that we're expected to provide, and the faith and the trust that the community puts in our hands when they hand us their family member, and people are tired. It's been 2+ years of fighting for this. When your leadership will not even agree to support you if you say that your assignment is too much, when we've been busting our backs for 2 years, it says volumes.
Other questions? Mary, if I may ask, small sample size, but it seems unusual to call a press conference before, when you are going to announce that you're going to take a vote, and then the day before when you're actually doing the vote. I mean, this is a lot of public appearances compared to other actions like this you've taken. I'm wondering why, and if you're trying to get the message out to the hospitals, if you're worried about loss of public support, if you need to get the message to your own nurses, maybe you can talk about the reasons for being so out front.
Well, you know, our 3-day strike was historic. It was 15,000 nurses from 7 different healthcare companies that voted to go on strike. The largest private sector in history. Now, Kaiser, not too long ago, that was 21,000 nurses were going to go out on strike. They would have topped our mark, but they settled. That is, of course, Kaiser was all one company. So that in itself, Jeremy, makes this in a historic event to be monitored, and I think our public are wanting to know. We don't do this lightly. We do this with heavy hearts. But we do this, and make no mistake, we do this for our patients. And so I don't think our standpoint can be stressed enough, because unlike our employers who don't seem to care, we do care. And we want to, through this whole process, we have done kudos to Sam Fettig and company and Amber and Lauren. We have done a fantastic job of keeping the public in the loop. So to me, it is not odd at all that we call you here multiple times. And I do appreciate that very much. But we're doing it to keep the public abreast of what's going on, because they have a vested concern. They're the ones trying to get into our hospitals. If anyone else wants to say, did you, Ellie? Or?
Yeah, real quick.
Yep.
I just wanted to respond to your question regarding like what the hospital environment is going to look like without us. It's ugly. We have anecdotal kind of evidence from people that are in the hospital when we're not there, and it's people that are not familiar with our community, that don't know our patients, taking care of our patients, and it's not ideal. I'll just say that. Yeah. Could keep going, but I'll probably be
Did I answer your question enough?
Yes.
Okay.
Other questions?
This might have already been addressed, and I realize you haven't voted yet, and.
Oh, we're voting right now.
Yeah, but
Yeah.
I mean, the vote is not in yet, I should say.
Mm-hmm.
Is there a timeline, if approved, if you do decide to strike, is there a timeline for how long that strike could be at this point, or is that still up in the air?
That we'll get the vote. We have to give a 10-day notice. If that, you weren't alluding to that though, right?
No, I mean,
Yeah.
once.
Yeah.
should
Yeah.
all happen.
We can post a notice as the very next day, if we want. You know what I mean? We have met. We're just not going to give out that information in our decision right now. That will be tomorrow at what time?
We'll be back tomorrow at
9 a.m. You get an extra half hour of sleep.
So you'll know tomorrow morning when you're gonna go out, if you're gonna go out.
It will be announced.
Okay.
It will be announced. You know, guys, here's the thing. Announce it right now when our vote isn't in.
Oh, no.
God, I'm just saying the rationale is, and telling you all in transparency is that would be hugely, that would be a real a mistake on our part to assume the vote. I have my hopes because I know where our power lies, and it's the only power that we have is 15,000 nurses standing together for our patients. That's the only power that we have as workers. And so I have my hopes, but I am not one to assume.
I guess
Mm-mm.
my question is, do
No.
strike or
No.
like? do they
No,
know?
our ballot, nope, they'll know tomorrow, or, you know, they'll know tomorrow or in the near future. Like I said, the ballot says you will vote for strike or you won't, or you'll authorize. You will authorize the team to vote for a strike or not to vote for a strike.
So potentially an authorized strike taking place could be until a contract.
Correct.
which
Yes.
Could be 2 days or 2 months.
I
Could
hope
be.
so. I hope this, you know, at the risk of sounding mean, I hope this makes our employers nervous.
They should be nervous.
They should be nervous. That's what
With the
we're
state
trying to
of things
say.
right now, they should be in disaster mode.
So it's all on the table, a 2-day strike or a 2-month strike, that's all on the table.
Yes, yes, and you'll know more details after the vote. It wouldn't be prudent of me to sit and even suggest anything unless I'm sure that we got the vote. Because remember, we have to have 2/3. 2/3 have to approve to go on strike. So,
Mary, if I can jam in one more question. You've talked about how there's a right time for a mediator, and that's when you're much closer than you were before.
Mhm.
You're closer now, and I think in a couple tables you may even have mediators involved. Is it the right time for all these tables to bring in a mediator to bridge the gap and maybe help get some of these safety things in place?
yeah, like I said, if our employer could have figured out how to get us to a common table, which they were the ones that couldn't seem to pull that off, we were all set. We all had our agreement, but they couldn't get all of their employer buddies to all agree. Okay, that is a place in the past where a mediator for sure was used. That totally makes sense. I believe what we have done is give the power to whether you want to use a mediator at each individual bargaining table. Is that not right, guys? That's what we have authorized. So people, if they want a mediator, they can use a mediator. And so we're not dead set against it anymore, but we have left it up to the local. But I want to stress that the common table, which things could have moved faster, we could have maybe had more productive and got this done, but the employers couldn't get it together.
So have any of the bargaining units taken up that option of using a mediator?
Not sure offhand which ones have.
But
I-
some of them have.
Some of them have. I just don't want to inaccurately say who. I have an inkling in my mind, but I don't want to say it without, because boy, that gets me into real trouble real quick. But I think people are considering it. And they keep asking. So,
Everyone good? Great, thank you.
all right.